Always walk through life as you have something new to learn and you will. Jai Hind and a very warm good morning to one and all present here. Under the dynamic leadership of Dr. Nikhil Srivastava Sir, Principal and Dean Subharti Dental College and Hospital, in continuation with Subharti Alumni Lecture Series, it is my honor and privilege to welcome you all. I, Dr. Napreet Kaur, Assistant Professor, Department of Pediatric and Preventive Dentistry, delighted to introduce today's enlightening session, which will be led by our esteemed guest speaker, Dr. Renu Dagur ma'am. Before we move forward, I would like to invite Dr. Vivek Rana sir, in charge, Department of Pediatric and Preventive Dentistry, to formally welcome and introduce our guest lecturer today. Vivek Rana sir.
Jai Hind to everyone. A warm welcome to Dr. Renu. Dr. Renu, kindly accept the floral welcome as a token of respect and appreciation from the Department of Pediatric and Preventive Dentistry. Now, I would like to invite Dr. Tushar Puruthi to formally introduce our esteemed guest speaker, Dr. Renu.
Thank you so much, Rana sir. Jai Hind, everyone. It is my pleasure to introduce our speaker, Renu ma'am. Ma'am is a pediatric dentist based in Meerut, UP, with over 18 years of experience in the field of dentistry. She completed her BDS in 2003 and MDS in Periodontic and Preventive Dentistry in 2008 from Subharti Dental College. Presently, ma'am is serving as a professor in Department of Pediatric and Preventive Dentistry at Kalka Dental College and Hospital, Meerut, UP. In addition to academics, she has specialized pediatric dental practice in Meerut at Kids Dental Village. And she is also associated with the platform I am the best mom, rendering her service as an expert in the field of pediatric and preventive dentistry to support the maternal and child's health. In 2018, MAMS received an Ionic Health Excellence Certificate from Times of India for her service in the field of pediatric and preventive dentistry. She has been author to various publications and keynote speaker on various topics with special interest on the topic child abuse and neglect. Now, I would like to invite Renu ma'am for their insightful lecture. Thank you, ma'am.
Chair Hind. A very good morning to all the esteemed dignitaries of Subharti University, my respected teachers, seniors, juniors, colleagues, and their students. Before I begin with my presentation, I would like to take this opportunity to express my heartfelt gratitude for giving me this chance to connect back to my roots, my college. I would like to thank the one and only visionary, the founder of Subharti Institution, respected Dr. Atul Bhatnagar sir, respected Vice Chancellor, Major General G.K. Thaplial sir, respected Principal Dr. Nikhil Srivastava sir, Alumni Series in charge Dr. Vivek Rana sir, and entire Subharti family for giving me this opportunity to interact with you all. Today, I'm here to share my views and experiences as a pediatric dentist about setting up of an exclusive pediatric dental clinic. So, as we begin with the topic, the dental industry has witnessed a significant growth in recent years. And according to IDA, they say Indian market presents lucrative and diverse opportunities for the dental professionals. Today, when we talk about the setting up of pediatric dental clinic, so the reasons that we find for all these sayings are, first is increased child population in India. According to UNICEF statistics, they say with a birth of 25 million children each year, India accounts nearly for one-fifth of the world's annual child birth. The other reason why India has become a lucrative, is offering lucrative opportunities to dental professionals is the changing lifestyle. Nowadays, children are the feeding and eating habits have changed. They are more on formula milk. They are more on soft processed food, and there are increased incidences of allergies, because of which their development of oral habits and cavities thereby, and there is greater emphasis on aesthetics. This I have witnessed personally, as during the beginning of my practice, it was very difficult to convince the patients for stainless steel crowns, and nowadays patients as well as parents, they willingly opt for the aesthetic crowns like bioflex and zirconia crowns. And nowadays there has been lots of advancement in the technology, and because of which the dental treatment has become more precise, efficient and attractive. No longer 15-20 days a month for RCTs. Now it's done in single visit. RCTs are in trend, and they are more beautiful and aesthetic crowns and colorful fillings for the kids. They are there available. So because of which people seek more dental care than what was there in past. Then we plan of establishing an exclusive pediatric clinic. We have to focus on improved healthcare services to children. We should focus on building an environment which is child friendly, and because we know that if the child is comfortable at ease during the treatment, he is more willing to comply with the treatment, more willing to develop good oral habits, leading to long lasting results. And as nowadays people are getting aware about the importance of early intervention and what is preventive health care for children. So with this knowledge, there has been an increased demand for the pediatric specialty and the facilities we provide. And if we want our clinic that it should have a long-term success and reputation in the community, it is very, very crucial that we go for the holistic approach. Just filling a cavity or just giving a crown won't do. We have to focus on educating the children of the community. We have to provide them preventive care so they are uh, they don't face that trauma of swelling, pain, and injections. So we have to focus more on preventive care. In this lecture, we'll we divide it into three parts. First would be the planning, then the clinical design, and lastly the marketing strategy. So for as we begin with the planning and research, we there are certain factors that we have to take care of, because when we are opening a pediatric clinic, so we have to see that where will we find this pediatric population? Near a school, near societies. There are more chances of getting pediatric patients, because it is convenient for the child to visit, either while the parents are bringing them to the school or dropping them or picking them up from the school. And at the same time, we have to take care of factors like economic status, marketing trends of that particular area where we plan to open our clinic. Because as we all know that dental treatment is costly and expensive than other, it's like we have to see that if the economic status is not that good, then the population residing there would focus towards the basic treatment. The child will show up only during pain or swelling or some difficulties. But if the economic status is well off, then they'll focus more towards preventive care and the some expensive options they can take up. And at the same time, we have to see what are the market trends, that what kind of treatment people are in routine they are seeking in that particular area. And we should also look for the competitors, means the number of practitioners, dental practitioners, and the number of pediatric dentists in that area. Because it's better that we provide our services in an area where there are more children and less number of dental practitioners or the pediatric dentist. At the same time, if we plan to shift towards if you want to open our clinic in some other city, or we plan to shift in some city, while opening our clinic we should keep in mind that the culture and the language, we should be comfortable with it, because while treating the child we have to deal with the psychology of the child, and if we are not able to understand what the child is saying and what is the culture of that particular community, then it would be difficult to treat the psychology of the child and also to deal with the psychology of the parents as well. Because as we have studied in periodontic treatment triangle, it's not only the uh, patient, the child patient we are dealing with, we are also dealing with the parents, we are also dealing with the society, the culture and the beliefs that are prevalent in that particular area. So coming next in the planning and research are the vision and the mission, because these are two things that should be clearly defined when we want to open a clinic. Vision is something that we want to achieve. It is basically that, for example, we want to provide excellent dental care with a compassionate and playful atmosphere. In long term, we want to get known with this for this fact that we are compassionate, and in our clinic, children get a playful and a child-friendly atmosphere, and we treat the child with gentle care. And whereas if we talk about mission, mission is we can say the reason why we exist, what we do in our day-to-day practice to achieve our vision. So, for example, if we are opening a clinic, a dental clinic, with a mission that we educate the child about the importance of oral hygiene. Every child coming to us, we will try to offer them a top quality dental care. And gradually, when the patient will keep coming, we'll keep educating them, we'll uh, try to give them the top quality dental care, then automatically with passage of time we'll be nearer to our vision, that we'll be well known for our compassionate care and for our playful atmosphere, child friendly atmosphere. At the same time, budget budgeting is very important, because as we know that dental treatment is expensive. At the same time, setting up a dental clinic is also very expensive, and machinery and equipments that we want to procure for our clinic, they are expensive, and accordingly we'll have to decide and we have to select the kind of space and the kind of equipments according to our budget. So we have to keep in mind every time what are our finances they allow us. And the legal and regulatory considerations. This, I think everybody has to be very, very thorough in it, because we all know that there are certain formalities like degree registrations, then registration of the clinic name at the municipal corporation office that we need to do, CMO office registration and renewal, periodic renewing of the registration has to be done. Earlier it was yearly, now the time has been extended. Then we have to get the clearance that is the Atomic Energy Regulatory Board. So we have to get clearance for the radiation, and fire safety is also there. As in my clinic, we have kept this emergency exit and this fire safety. And biomedical waste registration is very important. So we need to paste this chart also in our clinic, and at the same time dispose the biomedical waste accordingly. And insurance, I think against professional liability and medical malpractice, insurance should also be taken up as dental, because we can, while dealing with the patients, somebody might encounter some medical legal case. And if you plan for a pharmacy, as we have done in our clinic, so we need to have a diploma in pharmacy, the degree should be there, and along with it, we should have a retail drug license that is issued by the state board. Now coming to the second part of the lecture, that is the clinical design and layout. This is what my clinic is, in which we have for the ground floor, we have kept for a clinic, and the first floor we have kept for some, like we go for some events, kids related event we do here. So we have kept this area for all our kid related activities or our dental activities that we do periodically. And my clinic design is somewhat inspired by this, because as we enter, we find a play area, and this play area leads us into the waiting area. And here in the midst of the waiting area, we have a front desk where we have our reception. And on the sides of the reception, we have entry to the consulting plus dental operatory room. It's common in my clinic, and there is a small entrance, a small door opening to the to the sterilization room and mini lab. And this is how my clinic has been designed. As we can see that this is the waiting room, the reception, and these are the entrances to the operatories. We have two chambers, and this is to my kids, entrance to my kids dental village. So when we are making the waiting area, it should be spacious, and the flooring should not be it should be non-skid flooring, so that the children don't slip, because normally we want our clinic to look good, and people go for polished floorings and glossy flooring, so that is not advisable in kids. And when in our waiting area and the reception area, we should try to add some warmth. And I have this quote written on my door, that is, when you enter this little room, consider yourself one of the special member of a group who enjoys your company and likes to see you smiling. So this is what I have added to my door. And now coming to the front desk staff. This staff is very, very important, as it is the maker or breaker of your clinical success, because a receptionist has to be very friendly, very patient. She should be very observant, taking care of all the things, and she should be clever enough to schedule your appointments carefully, and at the same time answer all the patients' queries wisely. And the staff, when we are talking about the pediatric staff in the clinic, then we should also take care of the like and dislikes of the children. Like, for example, children like to have a playful environment. They don't like the environment that a typical clinic or the hospital has. And they like bright colors. They like open spaces to move on. They don't like to restrict at one place. They don't like their seating to be such. and they like to play with objects. They want toys. They want a positive environment. They want praises. So, and they also like being termed as grown-ups or big boys and girls. So even the front desk staff also has to take care of it, that they treat the children accordingly. They don't say or do something that is disliked or objectionable by the child, so that they create a positive environment and a positive feel in the child. Calling them small, immature, asking them not to touch here and there. These are few things that the staff should not do. Otherwise, children, they don't like it. Other clinical staff includes pediatric dentist, of course, that is we. If we are doing, we are setting up our clinic after VDS, then we are there, and we should also have a tie-up with a specialist, a pediatric dentist, so that in case where we are not able to perform the treatment, they can come to our help. And along with that, we have other clinical staff, dental assistants, dental hygienists that are there to educate children on dental hygiene practices. And the staff should know this fact that accept every child patient as it is, with their queries, their fears, and their hesitation. They don't like that we correct them all the time during the treatment. We should accept the child. Every child is different. So this is my clinic's play area. Here we have small mats, we have a height chart and some posters trying to make it colorful. We have the small horse, so children like to ride over it. So it should be, we have different ways by which we can try to make it colorful and bright for the kids. Aquarium is one such good option. And what are the benefits? Aquarium is that it has a calming effect. As the children, when they enter the dental clinic, they are very stressed. So it helps to reduce the anxiety and stress in the children. And they also help in aquariums, they help in distracting the child. And they are also mode of communication. They foster conversation. You can start conversation about the fishes or about the sea creatures. They provide sensory stimulation, and obviously they are aesthetic, and they have a positive association. They provide a positive association. The child feels less stressed and more finds it more child friendly. And one thing is that we should devote a room or a particular area for health education. This is a space where we can give instructions related to oral hygiene, like how we have to brush, how we have to floss, how many times a day. Here we can keep a mirror, a model of the teeth, or we can keep some posters, pamphlets, charts. They can be kept here in this area, brushes, so that we can do the we can go for proper education of the child regarding dental, keeping the oral hygiene. Now coming to the treatment rooms. The treatment rooms should be child friendly. They should not be fear provoking. They should be colorful. They should be bright. And we can also decorate the ceilings. Like with the theme of solar system or fishes, sea creatures. We can we have soft lighting, not very bright and disturbing to eyes. And also kid-friendly chairs are also there. So we can keep these chairs, though it can be slightly problematic when we are dealing with obese children and slightly bigger children in age. That time they are not that stable. Otherwise, kids-friendly chairs, dental chairs are available, and they are real good distraction for children. They find it very exciting to sit on these chairs. And as I said before, also that we have to keep in mind the likes and dislikes of children. Like they like bright, bold colors and hate dull colors like black and gray. So we should not keep such theme for kids. At the same time, we have to keep in mind about the smell and the sounds that are there in the treatment room. They don't like strong smells. Like, for example, we have eugenol smells and acrylic smell. They're very strong, and kids they are they dislike them because they're fear provoking. At the same time, the loud sounds of compressors and handpieces can also be disturbing. So what I have done in my clinic is that I could do that. I have kept compressor out of my clinic in the service lane. And earlier, when I had limited space, that time I had kept my compressor underground. There was a whole duct, and I kept it underground. So the sound was comparatively lesser. And the hand pieces that we are using, we should have with low vibration. We should use low vibration instruments, or we should prefer with lesser vibrations. And this is my treatment room, my operatory. And this, we can see that there's a monkey hanging over my dental chair. And at the same time, I have kept these small affirmation cards on all sides of the walls, quoting like I am brave, I am loved. They instill a positive feel in the child. And in front on the ceiling, we have this audio visual distraction where children can play any game, they can play their favorite videos and cartoons, songs, anything they want to. This is my sterilization room, small room. As we can see, this is the opening. This door is the opening to the small sterilization room and the lab, mini lab. Now, when we are treating a child, we have to make the child comfortable, and the patient can be comfortable even with the small things. And like in my case, even this small soap dispenser in the shape of frog is very distracting and very exciting for the children. So we can have a fun themed environment. We can use cartoon characters or some engaging decor we can use. And like I use videos in the audiovisual aid we use, and music during the treatment. We often play rhymes and all, and they have a very calming effect. The music is very helpful. And such small posters like an elephant near the elephant and clouds near the hand washing area. So all these, for me, they have always served as great distraction tools. And we can also allow parents in the operatory because the child feels more comfortable in their presence. And dental chairs, of course, we have talked about it. They should be comfortable and they should be adjustable for children of various age. And low radiation pediatric dental X-ray equipment should be available. Like nowadays, we are going more for RBGs. And if we have OPG in our clinic, then we all know that we have a separate room with lead sheets in the walls. We have designed a separate room, and the wall thickness is also more. It's not that initial what we keep 4 to 6 inches, it is more than that. And we should also have this caution displayed on the door of the room, that so that the children, they don't enter this room. And all the tools and instruments that we keep in our operatory should be child friendly and should be colorful if possible. For example, we have lasers. This is to reduce the pain of the child. I use more of insulin syringes for infiltrations, or we can use this. Nowadays, we can put our syringes in this cover of crocodile so that the child doesn't understand that we are about to inject. Mini hand pieces and colorful trays, colorful cotton holders, and anything that we can use which can be convenient or comforting for the child. And after that comes the attire of the clinical staff. Here I would like to say the receptionist, they should also be dressed up in the colored and the bright colored dress so that child finds it more comfortable to talk to them and find them more friendly. And the clinical staff is especially, they should be dressed up in some colorful head caps or different masks and scrub suits. They should be child friendly. An important thing is when we are treating a child, uh, gifts and rewards are very important. Because first of all, when we are treating, we should understand what is the difference between a gift and the reward. Gifts are basically those that are freely given to the child. And reward is something that a child earns when he uh, behaves in a proper manner during his or her dental treatment, then we reward the child. But whether we gift a child, whether we reward a child, we should not bribe a child, because giving gifts before the treatment and trying to make them agree to sit on the chair or get the treatment done is not the right approach. We should always try to develop, we should have a positive reinforcement, we should give them after they have behaved in a certain manner. It should be a token of appreciation for their efforts. And even small gifts and small gestures like praising the child or patting the child on the back is very important at times, and it is very rewarding for them. And now coming to the treatment of a special child in our clinic. So when nowadays we are seeing that there are so many uh, problems that are related, a child can, like, from handicap, being handicapped to having some problems like neurological disturbances, autism, cerebral palsy. So there are various conditions, and when we have to treat a special child, that time uh, we first of all see that there are certain difficulties in treating such children. They are special and they have some special needs, because the difficulties that we find when we are treating a child with special needs are that they generally require more time. Their procedures are much more difficult than the other children, and most of the times even dentists, they have not taken that special training to treat them, which is required nowadays. And dentists are also not very comfortable. That's why they're not very comfortable treating them. So we face difficulty when we treat such children. And many of the times such children, they require hospitalization and they might have a life-threatening medical emergency. So these are few factors because of which generally dentists find it difficult to treat special children. And at the same time, when if we are planning that we are treating a child with special needs, so first of all we should try to get a training in the field of treating special children, because that will make us more comfortable and more confident while dealing with such children. And along with our training, we need to have certain requirements fulfilled in our clinic also, so that we can treat these children easily. First of all, enough parking area is required, because we most of the time such children, they are on wheelchairs, so easy loading and unloading of wheelchairs, they require time. So we need to have enough parking area so that we do not block roads, and there is standard space with some extra width space of 144 inches, as they say it is required. Normally it is 96 to 108 inches. And there should also be, if possible, the provision of ramp or lift for the wheelchair, because even if we are on the ground floor, then also it is difficult to climb these stairs. It is very difficult, so we should have provision of a ramp, and in case we are on some first or second floor, then the lift. And we should also take care that while we are treating special children, we should remove doormats, so there are less chances of skidding or slipping. And we should have easy adjustment for the transfer of patients from the wheelchair to the dental chair. And mouth props should be used in such cases, because sometimes the coordination is not that proper, the neuromuscular coordination is not that well, and it can lead to some unexpected accidents. So mouth props should be used. And this is a video. Uh, the other factor that we have to keep in mind is that the treatment rooms should have flexibility, or I can say flexibility is the key, so that we can easily transfer the patient from wheelchair to the dental chair. There should be complete mobility of the instruments that we are about to use, the equipments that we use. They should be stored away from the center, and when we require these instruments and equipments, they should be easily brought to the dental chair or to the center of the room. So we should keep in mind that if we are treating a special child, we have to be very flexible. And now coming to the pediatric dental services. When we are opening our clinic, we have designed our clinic, we have to keep in mind that we have to provide dental services to the children. So one of the important factors that we have to keep in mind is we have to manage the child, the behavior management of the child. For that, we have non-pharmacological behavior management technique and the pharmacological management technique. In this, the non-pharmacological, I'll not go into the depth, but we have modeling by Bandura or Del Shodu technique. We have different ways. And in pharmacological, we can have oral sedation, or we have inhalational sedation, intravenous. So at my clinic, I practice nitrous oxide inhalational sedation technique. And we also need to publicize that what kind of care, like preventive care we are giving restorative care. So when we are planning this clinic and we are designing our clinic to give pediatric dental services to the community, we need to focus on these services, and we need to have all the materials and the equipments that are related to the restorative care, some emergency care. Like in emergency care, we talk about traumatic dental injuries, where we need to have the media for storage of tooth, or we need to give some emergency care. So we need to have all those facilities at our clinic. And orthodontic interventions, the early interventions, consultations, and sedation dentistry, as I spoke, that we should be able to manage the anxiety of the child regarding the dental treatment. So these are few of the treatment that we are doing. And as I said earlier on, it was more towards the stainless steel crowns. Now it has become aesthetics. We are doing the zirconia and bioflex crowns more than stainless steel. and early interventions like correction of cross bites or minor malalignment of teeth and inhalational sedation. Now coming to the third and the last part of the lecture, that is the marketing and community engagement. So when we talk about marketing of our clinic, we have to create an effective marketing strategy. For example, we can go for local advertising. We can distribute flyers. We can put posters in pediatricians' offices and schools so that the people in around the community should know that some clinic has opened up which is catering to the needs of the children, the child's dental health. And at the same time, it is very important to have a website or some kind of online presence. You can create a page, you can create an Insta account. Regularly, you can post your cases or you can post some oral health tips for the parents and the children as well. And at the same time, you can go for community outreach initiatives, which I frequently do, like visiting schools for free checkup camps, or we can put free dental checkup camps at local fairs that we have done, and some other health clinics, like with a tie-up with a pediatrician clinic. We did that also. So it is also very effective in letting people know that pediatric dentists are different from other dentists and the children, they need specialized care. So it is very important in giving this message. And these are some of the photographs of various camps in various schools of merit. And at the same time, we have to keep doing some activities or be active at a clinic also. Like this, we conducted recently with the name of Muskan 2025, in which there was a coloring competition and motivating the children through stories. There was story time and giving them demo of brushing, flossing, and doing their dental checkup. We really need to update and upgrade our knowledge. And it's not about the pediatric dentist only, it's about the clinical staff also. Because the dental health provider as well as the staff in the clinic, they both need to upgrade their knowledge from time to time through various CDs that we attend or some seminars, webinars. They help to be updated. And last but not the least, I would say high quality patient care and services. They are the first step for making your clinic successful, because mouth to mouth publicity is slow, but it is sure that it will yield results. Effective patient management system, appointment scheduling and record management is very crucial in your clinic success. You can also give calls or you can send messages to the children, your child patients, on the occasions like if it's their birthdays or if it's Children's Day. So this also gives a warmth and a personal touch and a sense of that you care for the child if you do this. And at the last, I would say that positive dental experience is very important for a child to develop good oral hygiene and to comply with the treatment. When the child will feel safe, he will develop good oral hygiene. And if a clinic is well designed pediatric dental clinic, then it is very likely that the children they get a good dental care, preventive dental care, and it can help to prevent future dental issues, and it can make the community and with coming up generations, they'll be free from the dental diseases if we focus more towards the preventive dental care and towards we have a holistic approach by treating the child. So again, at the end, I would like to thank all my respected teachers and all the esteemed dignitaries for giving me this opportunity. And please, if anyone has any question, most welcome.
Thank you so much, ma'am, for such an informative lecture. I'm sure everyone must have gained the key points required for setting up a dental clinic. So we have two questions, ma'am. Shall I start?
Please.
Okay. Ma'am, so first question is that how to prepare a child for a dental treatment?
Okay. So, when we talk about making a child ready for a dental treatment, so firstly, it is a combined effort of both the parents and the doctor. But here, I would only talk about the dentist part. That what things we should keep in mind is first the timings of the visit, because a child should not be hungry, he should not be sleepy when we are scheduling his appointment, and he should be fresh, and we should not consult in near the dental chair. It should be away from the dental chair in a casual environment, and we should keep in mind to use positive language so that the child can understand, and we should explain the procedure before we begin the procedure. So these are few things that can help.
Okay. Second question, ma'am, that what is the impact of color in the clinic and design on the child psychology?
Okay. So when we talk about color psychology, it's not a modern concept, and its roots they stretch back to centuries, I would say. And like colors can be like they can affect the mood and the behavior of the child. And when we talk about the color spectrum, the warm colors like orange, yellow, these red colors, they are energetic colors. They give energy, and they make the child happy. They give happiness. And blue, green colors, they're supposed to make a balance, peaceful. And when we move towards the cooler spectrum, like purple and light blue shades, then they provide calmness and peace. So I think when we are designing our clinic, we should try to maintain a balance between these colors, so that there should be a balance of happiness, energy, and a calmness, because too much of white could be uninspiring. Black is related to mysterious things, so we should avoid using dull colors, and a combination or a balance between the colors will surely have a good impact on child psychology.
Surely, ma'am. Thank you so much for those wonderful answers, ma'am. Now I would like to request Dr. Pradeep Raghav sir to present the certificate of appreciation to Dr. Renu Dagur, ma'am.
Jai Hind and good morning, Dr. Renu.
Good morning, sir.
It's always a pleasure to see you. It was a wonderful presentation.
Thank you so much, sir. Thank you so
And
much.
it is actually a very apt topic in the modern context because nowadays pastry practice is becoming very more and more prevalent and more popular also. And I think this topic will help our PG students and all the listeners about that how they can open up a pediatric specialty clinic. Thank you so much, Dr. Renu. It's always a pleasure. You have been one of our favorite students of the college.
So you won't understand, sir, how nice and how grateful I am to my teachers, so for like making or shaping my career where it is or wherever what small I could do. So thank you for being there, for your teachings and for your wishes, sir. Thank you so
Thank
much,
you.
sir.
Actually, today our principal sir could not come because his flight got delayed, so he will be coming slightly late. So that's why I am here in for representing principal sir.
It's a pleasure to see you. Though if sir would have been there, it would have been much more. But sir, always a pleasure to see you. Thank you, sir.
Thank you. Please accept the certificate of presentation. Thank you.
Thank you so much.
As we conclude today's lecture, I, Dr. Navpreet, extend my heartfelt gratitude to the esteemed founders of Subharti institutions, respected Dr. Atul Krishna sir and late Dr. Mukti Bhatnagar ma'am, for their visionary leadership and immense contributions that continue to inspire us. I would also like to take a moment to thank our young and dynamic CEO, Dr. Shailya Raj ma'am, whose visionary, leadership, and innovative approach continue to propel our organization toward greater heights. Heartfelt gratitude goes to our Vice Chancellor, Major General G.K. Thaplyal sir, for his constant guidance and encouragement. A big thank you to our esteemed guest speaker, Dr. Renu Dagur ma'am, for sharing her valuable insight with us. I would also like to acknowledge and thank the entire organizing team. First and foremost, our dynamic principal and head, Dr. Nikhil Srivastava sir, for his constant encouragement and motivation. Dr. Vivek Rana sir, Dr. Nupu Kaushik ma'am, Dr. Tushar Pruthi sir for their support and all the postgraduate students of the Periodontics department for their hard work and dedication. A special thanks to IT department of Subharti University with heartfelt appreciation for Mr. Shubham Kaushik for ensuring the smooth conduction of today's lecture. Lastly, I extend my gratitude to this wonderful audience for your presence, patient listening, and active participation. Thank you all and Jai Hind.